Hi, this is Gina Denick-Champion. I'm the Executive Director and Lobbyist for the Wisconsin Nurses Association, and I'm here to provide an update on the APRN Modernization Act, the goal of achieving full practice authority. Part of the purpose of the presentation tonight or today is to let you know about the legislative activity and also to provide an update on the public hearing that we thought was going to take place next week. But I want to start with the rationale for why we need this legislation. First of all, APRN practice needs to have a separate license in Wisconsin as it legally identifies the advanced clinical knowledge, skills, accountability, and responsibilities for the employers and the consumer. We do practice more and at a higher level than we do the registered nurse. And the APRN practice has been around for quite a while, that we think it needs to be its own licensure at the state level. So the legislation reflects the 2008 APRN consensus model, which has been adopted by over 23 states. It's called the LACE model, which stands for licensure, accreditation of the schools of nursing that are graduating advanced practice registered nurses, certification, meaning the national board certification that the advanced practice nurse holds, and education, that you're graduating from an educational program with a minimum of a master's degree or post-certificate, master's certificate, or higher. So in terms of our history, in 1995, Wisconsin was one of the first states that acknowledged advanced practice nurses as advanced practitioners, meaning they practiced and had the skills and abilities to do more than the registered nurse. The way they recognize these nurses by granting a certificate to prescribe, and the title for those individuals was advanced practice nurse prescriber. We talked about last night that NP always thought it meant nurse practitioner. No, it's nurse prescriber. In others that there were the majority of the APNPs that have this certificate here in Wisconsin, but there are also about 500 or so advanced practice nurses who are practicing in APN roles that do not hold a prescriptive authority certificate and therefore are not recognized in statute. So the goal of this is to get everyone under what we call the APRN umbrella. Another piece back in 2000. So when the bill was passed in 1995, in 2000, a document, the requirement for a documentation of a collaborative relationship between the APNP and the physician was adopted in legislative or law. This happened as a result of the Wisconsin Board of Nursing at that time did not recognize that part of being a prescriber also included the need for the APNP to order laboratory, radiographies, et cetera. And it was because of this that WNA met and asked for the legislature to help clarify this rule for us. They did clarify in the rule that, yes, indeed, APNP practice does include the authority to order labs and x-rays, EKGs. But at the same time, we had the Medical Society of Wisconsin and the Academy of Family Practice Physicians that put this documentation requirement into statutes. We really weren't in a place to be able to object as much as we did. And we unfortunately have this in place and continues to be in place, not in statute, but in the prescriptive, the administrative code for nurses that address the prescribers, and that's N8. So why is it a good time to continue to really keep working on this legislation? There's many reasons. 23 states, like I said before, recognize the practice and the separate licensure of the APRN, including or giving them full practice authority. During the COVID pandemic, Governor Evers suspended the administrative rule that required APNP collaboration with a physician. And guess what? The sky didn't fall, and patients were taken care of quite well. And there were some of those nurses that were practicing, NPs that were practicing independently, that didn't need the, did not use their collaborator at that time or did not pay them. The other big thing, obviously, is in regards to our patients. So, and in terms of primary care and our specialized services, we know that access continues to be problematic. So when we talk about our primary care, that's our, our clinical nurse specialists and our NPs. We know that our certified nurse midwives are out there and also providing care based on demand. And there's also our CRNAs that are practicing in lots of parts of Wisconsin, small hospitals, rural areas, where there are not anesthesiologists and practicing and taking care of patients getting access to surgical and pain management services. So we know that there's greater utilization of all of these APRNs, but we continue to find that the barriers to practicing at the top of license because of collaboration and other sorts of statutes that might be interfering remains a dissatisfier. So it is time to introduce and continue to work forward with legislation. So what's happening now? We've had the introduction of the APRN Modernization Act, AB 369 or Assembly Bill 396 and Senate Bill 394 have been introduced and are assigned to the Senate Health Committee and to the Assembly Health Committees. On the Assembly side, the bill sponsor is Representative Rachael Cabral-Guevera. Rachael is a nurse practitioner, APNP, and also owner of her own NP practice in the Appleton area. On the Senate side, we have Senator Patrick Testin from Stevens Point, who is the chair of the Senate Health Committee. And we're really thinking that obviously this year, being chair of the Senate Health Committee and sponsor of our bill, that we will at least have a hearing, public hearing this year, which we did not and have not had that opportunity. So just want to share the future APRN practitioners once this bill is passed. It includes all of the APRNs under the same umbrella. So that includes those 509 APNs that are not identified. You will be identified in state statute and assigned a license by your role and be part of that. We have for once a collective of advanced practice registered nurses in Wisconsin. So I want to go through what the AB 396 and Senate Bill, excuse me, 394, what's in the bill. So I'm very sorry, provide a separate license for the APRN. So you'll still have that RN license, but with that will be the APRN license. It will include the practice role. So your APRN license will also indicate if you're a nurse midwife, a CRNA, a CNS, or an NP. Title protection is provided for the 4 roles as well as APRN, and not just these initials, but the actual words when they're spelled out. It also allows APRNs currently practicing a recognized role to receive an APRN license. Replaces APRN, APNP with APRN in over our 50 state statutes. If you were to look at the bill, it's about 70 pages, and that's the sort of the heart of this bill, which is defining and describing the APRN Practice Act, starts at about 38, 39, page 38 or 39 in the bill. And the rest includes all of the substituted language. I want to go back to allows all APRNs currently practicing in a recognized role to receive an APRN this license. This is the grandfathering that we worked with together in terms of all of the 4 roles, so that we don't try and take any APN who's currently practicing with, that are not identified as an APNP or prescriber, but will be allowed to practice. It repeals state statute 441.15, which is the Nurse Midwife Practice Act. And it also repeals 441.16, which is the section of the statute that describes prescription privileges for advanced practice nurses. So the bill, in terms of some of the being able to get a license, is the board will need to see that you graduated from an accredited APRN education program, that you've graduated with a master's degree or a postmaster's certificate or higher in one of the 4 roles, that you hold national board certification that is approved by the Board of Nursing, and the board has a listing. And you need to show that you have evidence of having medical malpractice insurance coverage. In addition, the legislation now includes a description of the scope of practice for each of the 4 roles. We included this as a compromise with the Wisconsin Hospital Association, and the descriptions come from each of the organizations. So the CRNA description was provided by the Wisconsin Association of CRNAs, the nurse midwives, the same thing, the clinical nurse specialists, and the NP came from WNA. It also, again, part of a compromise. And I just want to say, we know that this is a practice standard, but wanting to, WHA wanting to see some sort of statement that when the APRN is caring for their patient and the needs of that patient exceed the expertise of the APRN, that the APRN will consult, collaborate, or refer the patient to another healthcare provider. And I know we see this every day. Sometimes we're referring to a specialist. Sometimes you might be, a physician specialist, a surgeon, or a cardiologist. But it also may be a physical therapist. It might be an occupational therapist. It might be a chiropractor. It might be, even a dentist. So that's sort of what this gets at. Yes, we know it's a standard of care, but it's in there, and no harm, no foul, I want to say. It also allows for the delegation of a task or order to another clinically trained healthcare worker. So again, we'll have to remember the 5 points of delegation. When we're delegating, who you can delegate to, what you need in place in order to delegate. It requires 16 hours of continuing education in clinical pharmacology and therapeutics. The next piece is the bill refers to the Board of Nursing in terms of creating the administrative rules. And the goal of creating the administrative rules, instead of putting all this stuff in statute, is that the rules can be changed more easily, and it stays under the auspices of a Board of Nursing that understands our nursing practice. So what the board will have authority to do is the board may establish additional criteria related to the practice education or certification for that APRN non-prescriber. If we think about it, when a new person, a new advanced practice nurse comes and applies for a prescriber certificate, there are a number of things that they need to show or declare to the Board of Nursing in order to get that certificate. There's also what we call a jurisprudence exam. So for example, the APN, so let's say it's a new grad and they're applying for their prescriber certificate, they need to show and talk about what school they graduated from. They have to verify that they received the 45 hours of clinical pharmacology. They need to verify that they have malpractice insurance coverage. They need to also show that they've had CE, and you think about the practice, of course, you've had all sorts of that education. So with that, this is how the board begins to know who the APNP is. And then the APNP renews their license every 2 years, and then again verifies, that they have all of these things. So in this case, I am assuming that the Board of Nursing will be looking at what it is they're going to need from a non-prescriber in order to issue that APRN license. I'm saying this because we're talking about grandfathering, and we know that not every APN right now has 45 hours of clinical pharm therapeutics that they received either within their educational program or that they've pursued getting the 45 hours post-graduation. So we know that that would be a standard to prescribe. We also know that there are APNs who do not have the national board certification that the Board of Nursing approves. And the certificates, the national board certifications are recognized by the board, but they all come from the recommendations of the National Council of State Boards of Nursing, who have adopted, remember that APRN consensus model, where they talk about the national board certification being part of the population foci. So it's the populations are more general. And then when you graduate, when you begin to practice, you can also become certified in the specialty that you're in. So we have APNs that have certificates, or excuse me, national board certification, but not the one that the Board of Nursing has identified. So obviously the board, I'm assuming, will also want to know about any certification or certification that you have, so that, again, they know about you and what sort of practicing, and that you won't be prescribing. They may promulgate rules regarding the CE requirements. They're going to further define the scope of practice for the APRN. It shouldn't be prescribers. I'm sorry, I did not get rid of that word. It would be further define the scope of practice for APRNs. Like I said, approving the national board certification organizations, establishing the appropriate education, training, or experience requirements. They also specify the classes of drugs, individual drugs or devices that may not be prescribed, and the conditions for the RN to administer a prescribed drug or under the direction of an RN. So again, we talked about the delegation piece. The board will need to talk more about how does that delegation occur, or what would that look like. So when a person is applying for their initial license, it will be because of the timing, we really want to have, hopefully this bill will get passed in time for the 2022 license renewal. We know that the DSPS, which is the umbrella agency for the Board of Nursing, will need to develop an APRN license. And the probability that that will be ready to go March 1st of 2022 looks, pretty probably will not happen just because of antiquated information systems that exist at the department. So what we're hearing is that you will renew your APNP certificate, which will convert to the APRN license. Now, for those APRNs that are not prescribing, they will need to, will apply more than likely for the APRN license and using, whatever criteria that the Board of Nursing determines to validate that or verify that you meet the criteria for licensure. So, and again, the license itself will indicate non-prescriber. So the license renewal process will be every 2 years in the even numbered years. You're going to submit to the board as usual your name and your residence, take the workforce survey, pay your fee, show evidence of having satisfied the CE requirements, and evidence of any malpractice liability insurance. So we talked about public hearings. And yesterday, when I provided this information, we were informed that there might be a hearing pending next week or the week of July 5th. And today we heard that there will not be a public hearing and no date has been determined for either committees. But things to think about is, when you hear about the hearings, to think about if you want to come and provide testimony in person or submit written testimony at the public hearing, attend the public hearing and register in favor, or send your letter to your legislators asking for support. The key folks that we want to talk to in this case will, or really sort of focus on, will be the Assembly and Senate Health Committees. And we will be providing the listing of those committee members and where they're from on the WNA website. WNA, we will continue to utilize our 3 lobbyists and myself, making it 4, to meet with legislators to talk about the bill. We will notify you of the date and time of the public hearing when it's confirmed. We will provide access to WNA's Nursing Voice, which is our grassroots advocacy platform, where you would put in your name and your address, and that system identifies your legislator, and will send your letter. We will provide a sample letter that you will personalize and send, and that will keep you posted on the results of the public hearing. So our WNA website is located on you can access the APRN Modernization Act on the website using the advocacy tab. And lastly, we continue to need your financial support in our efforts. Lobbying, hiring lobbyists is expensive but well worth it. But at the same time, we really need to not only ask you to share your voice, but if you would be able to open your purse or your wallet and send some money our way. And you can go to this link. So I want to thank you for listening. And if you have any questions, you can contact me at info, INFO, at wisconsinnurses.org, and I will respond to your inquiry. Thanks, and have a great day.